Bismillahirrahmanirrahim. Assalamu alaikum friends. Today we will discuss about the membranoproliferative glomerulonephritis. Membranoproliferative glomerulonephritis, it occurs in older children or young adults. Membranoproliferative glomerulonephritis classified into primary idiopathic, secondary forms of glomerular disease. Secondary causes of membranoproliferative glomerulonephritis associated with infection. Number one, associated with infection. Number one, associated with infection. Hepatitis B and C, syphilis, visceral abscess, infective endocarditis, shunt nephritis, Corton malaria, schistosoma, nephropathy, mycoplasma infection, and now second, associated with rheumatologic disease, SLE, scleroderma, Sjogren syndrome, mixed essential cryoglobulinemia with or without hepatitis C infection, anti-smooth muscle syndrome. Number 3, associated with malignancy, carcinoma, lymphoma, leukemia, and number 4, associated with an inherited disorder, antitrypsin deficiency, complement deficiency. Now we come on pathology. Primary membranoproliferative glomerulonephritis glomeruli is seen by light immunofluorescence and electron microscope. Two subtypes have been defined. Number 1, type 1 membranoproliferative glomerulonephritis is most common. Immunofluorescence microscopy reveals C3 and lesser amounts of immunoglobulin in the mesangium and along the peripheral capillary walls in a lobular pattern. Electron microscopy confirms numerous deposits in the mesangial and subendothelial region. Number 2, type 2 membranoproliferative glomerulonephritis less common. By electron microscopy, the lamina densa in the glomerular basement membrane undergoes very dense transformation with evident immune complex type deposits. Now we come on the clinical manifestations. It is most common in second decade of life. Equally affects males and females. Patient present in nephritic syndromes, hematuria, hypertension, and some level of renal dysfunction. C3 level very low. Differential diagnosis. What are the differential diagnosis? Post-infectious glomerulonephritis. Now, how we diagnose this case? Renal biopsy. Indication for renal biopsy. Number one indication for renal biopsy is nephrotic syndrome in older children, significant proteinuria with microscopic hematuria, hypocomplementemia lasting greater than 2 months. Treatment: no definitive therapy exists. Okay. Extended course of alternate day prednisone for a year provide benefit. Some patient treated with steroid enter a complete remission for their disease. What is the prognosis? Prognosis: untreated has poor prognosis. By 10 years following onset, 50% of patients with membranoproliferative glomerulonephritis have progressed to end-stage renal disease. By 20 years following onset, up to 90% have lost renal function. Those with nephrotic syndrome and hypertension at the time of presentation progress to renal failure more rapidly. So this is all about the membranoproliferative glomerulonephritis. I hope that you understand, you have understood this topic very well. Not very well, but little bit. All about my efforts, all about of my efforts, and now I end this topic here. Thank you.